Hi, welcome back to Dr. O'Donovan Medicine Made Easy. In today's video, we're going to be going over the BRCA1 and 2 tests, which are used to look for alterations or mutations that are linked with an inherited tendency towards breast and ovarian cancers. In this video, we're going to be going over a couple of key topics. First of all, we'll discuss what the BRCA test is used for. We'll then discuss why it's done, as well as how it's done. And finally, we'll move on to look at what the result means for both you and your family. So let's start off with discussing what the BRCA test is used for. So individuals with a strong family history of breast cancer or ovarian cancer might want to know if they've got an inherited tendency towards these cancers. Individuals who carry the BRCA1 and 2 genes have got a higher risk of developing these cancers, and so this testing can be useful. There are broadly two different types of BRCA test, and these are diagnostic and predictive. In terms of diagnostic testing, well, this is done in someone who's had a breast or ovarian cancer, usually in the context of a strong family history, and it can give you information about chances of further cancers and can also provide family members with the information that they might want to have a predictive test. Predictive testing, on the other hand, is the test done in an unaffected relative of someone who's known to have a BRCA1 or 2 gene mutation. So why is the testing done? Well, as we've already discussed, some testing may be useful to help you decide whether to take steps that might prevent breast or ovarian cancer from developing, or may pick it up at an early and more treatable stage. There are a complex range of options available, ranging from more frequent mammograms to surgical removal of the organs at risk, and you should discuss these in detail with a clinical genetics professional before deciding whether testing would be helpful or right for you. Your GP or family medicine doctor can refer you to your local clinical genetics service. So many people ask questions as to how is this testing done? Well, the test for BRCA mutations is usually done on a blood sample collected by a needle from the vein in the arm. The test doesn't require surgical biopsy of the breast or ovarian tissue, and occasionally alternative sample types might be possible, such as a mouth swab or a spit sample, but again, you would need to speak to the professionals involved in this testing. Finally, let's move on and just discuss what does the result mean. Well, since there are hundreds of possible mutations of BRCA genes, test results must be interpreted by taking into account the person's personal and family history. A genetic health professional should explain the meaning of the results and offer advice to the individual and to other family members about options for decreasing risk. Such advice should be offered both before the testing takes place and also after receiving the test results. Finally, you might be wondering, how does the result affect family members? Well, the test results can affect other family members. When one member of the family is tested for BRCA mutations, issues often arise about how to share this information with other family members. Most people will want to help their family members and may indeed only ask for testing in order to do so, but sometimes you might have lost touch with family members whom the result may be relevant to, or find it too difficult to tell them yourself. And again, your local clinical genetics service will be able to help you with this. I hope you found the video useful, helpful and informative. If you did find it useful, please leave a like and leave me a comment in the comments section below if you've got any questions. I do try to respond to all of the comments and questions that I receive. However, please remember this is an education platform and not a clinical advice platform, so I'm unable to give individual advice or interpretations of actual results. Once again, thanks for watching. I hope you found it helpful, and until next time, bye.